Hey everyone, how's it going? What I want to do in this video for you here today is go over my basic trauma kit or blowout kit that I have incorporated into my range bag here. In case you didn't see my other video, this is my Camelback Hog military version that I use as my range/training bag and whatnot. And as you can see here, it has a pretty large, substantial exterior pocket here that, as you can see, I have exclusively denoted for, or denoted, used, whatever, exclusively used for medical purposes, for medical gear and equipment that would be used for basically, like I said, a trauma kit or a blowout kit type deal, or, you know, mitigating any kind of severe hemorrhaging or bleeding that would be incorporated with something like a gunshot wound. So this is something that, you know, if you do a lot of shooting or you're serious about shooting and you have any kind of medical training, I feel that, yes, it is your duty and your responsibility to have these types of things on you and at your disposal, anytime you're doing any kind of shooting or firearms training and whatnot, because you know, accidents do happen, shit happens. Fact of the matter is, people get hurt sometimes, and you know, it's pretty rare. If you go to the next time you go to the range, look around and see if you can pick the guy that you know is going to have an adequate blowout kit or trauma kit available. And you'd probably be pretty hard pressed to find somebody who's got the right equipment or the right supplies to take care of any kind of injuries associated with a gunshot wound like that. So anyways, without further ado, what I'm going to do here is I'm just going to open up the excuse me, I'm going to open up the pocket, show you what I have in there, and just do a real quick, brief overview of why I have certain things and what, you know, what certain things do and what the capabilities are of these things. This is by no means a completely comprehensive kit. There are things that I could have in there that I don't have right now. A couple things like I don't have are dedicated chest seals, or like, you know, like a halo seal or something like that. I do have a substitute for that, but we'll get into that a little bit later. I don't have an NPA, Nasopharyngeal Airway is what that stands for, which is, if you've seen it before, it's basically a tube that, you know, you can stick up somebody's nose. It goes into their nasal cavity and enables them to breathe if their their airway is obstructed. I don't have one of those yet, but I do plan to get one. So yeah, anyways, without further ado, just jump right into the kit here and I'll show you what I got. As you can see, this is real easy to get into. Open up the bag like so, and the cool thing is this flap folds down and you pretty much have complete access to all the medical supplies that I have therein. I'll start kind of on the outside, work my way in. Basically disregard, this pocket is just miscellaneous things like batteries and chem lights and stuff. But starting on the outside here, have this little white box, and basically this is my boo-boo kit. It's just a little box with some, you know, hand cleaning wipes, band-aids, and a couple little gauze pads just for boo-boos. That's pretty self-explanatory. One of the most important things for you to have, in my opinion, if you're going to be rendering first aid to somebody who may be suffering from gunshot wound or any kind of trauma or hemorrhaging or severe bleeding or whatever, is a good pair of medical quality gloves. I have these gloves here that I bought from, I believe these are TacMed Solution brand gloves, or from there's a website, austereprovisions.com, where you can get all these supplies that I have. Pretty much it's where I get almost all my medical supplies from. I have two pairs of medical gloves here for two reasons. One, if I have somebody with me, which I usually do, you know, I'm gonna have them assisting me if I'm rendering first aid. If I don't have somebody with me, I'm gonna grab somebody who's willing, and I'm gonna have them assist me in rendering first aid to somebody who could have a potential life-threatening injury involving a gunshot or severe hemorrhaging or bleeding, you need to protect yourself, and that's your first line of defense right there. Second thing, I think everyone's familiar with these, trauma shears. You're going to want to have trauma shears. You know, somebody gets, you know, just as an example, gunshot wound or some kind of trauma involving a lot of bleeding to the leg or, you know, the abdomen or the chest. You're going to need to get their clothes out of there, and moving their body around a lot to try and physically take their clothes off like you would put them on is not a good idea. You're not going to want to move the person around a whole lot. You're going to want to not move them as much as you can possibly not move them. So cutting their clothes off is the best way to do that. So trauma shears, really good to have on hand. You know, pen, obviously, just for notes and things like that. I don't have my tourniquet in here right now. It's in one of my other bags, but you know, a lot of guys in the military know about this. If you apply a tourniquet to somebody, you know, chances are they're going to be receiving a higher standard of medical assistance once the paramedics or EMTs or whoever shows up. If you apply a tourniquet to somebody, they're going to want to know, and the medical professionals and especially the doctors at the ER or the trauma center or whatever are going to want to know and need to know pretty close to the exact time that you applied that tourniquet. So it's just writing on the tourniquet itself, if it has a space for it, or maybe writing, you know, the time on their hand or the person's forehead or whatever. You're going to want to have that written down somewhere, because I'm not going to get into it right now, but if, you know, having a tourniquet on for too long, you're looking at amputation. So the doctors and medical professionals are going to want to know when you applied that tourniquet, pretty close to when you applied it. Quick clot, self-explanatory. This is like a sponge type pad. They don't really sell or make, you know, like people see in like the old war movies where they tear the packet open and it's like a powder and they pour it all over the wound. It's not like that anymore. Excuse me. This is like basically a sponge that's impregnated with a clotting agent, and you know, pretty self-explanatory. You're just going to want to apply it to the wound, and it's going to start working instantaneously, pretty much. A good thing to do is follow that up with some kind of other dressing, but, you know, I'll show you that when we get to it. Moving along to, you know, wound packing, you're going to want to have stuff like this. These are H&H compressed gauze bandages. I have 2 of those, sterile compression bandages or compressed gauze bandages, and this is a Z-Pack dressing, which is also really good for wound packing. You know, if you're not familiar or you don't know about this, once again, hypothetical gunshot wound, you're going to want to need to pack that wound. If somebody has a gunshot wound to, let's say, their abdomen or whatever, you're going to want to pack that wound with something like these gauze before you wrap it up with something like a compression style bandage. You're going to have to pack that wound to mitigate the bleeding, or hopefully stop the bleeding as much as you possibly can. As far as compression bandages go, I have 2, just in case, you know, multiple gunshot wounds, or say you have an in and out type situation where the bullet has completely passed through somebody's body. In that case, you can take care of both sides. I don't know if you can see it, but these are the TACMed Solutions OLACE. I'm not really sure. It's an acronym, but I don't really, you know, OLACE type bandages, OLAES. They are a compression style bandage, much like the Israeli style bandages. The cool thing about these is, I don't know if you can see it in the picture there, but there is a pressure cone in the middle of the actual bandage. It's basically a little cone of plastic shaped like that, that will, it's not this large obviously, but it's on the bandage and it will go on top of the wound site area, so when you continue to wrap the rest of the bandage around it, it applies direct pressure to that area. The more you wrap it, the more pressure you get around it. And the really cool thing about these is, like I mentioned before, I don't have any chest seals or halo chest seals or anything like that. But inside these, you can't really see it here, but inside these, when you rip the package open the bandage up and get ready to apply it, there's a sleeve, there's a little area that opens up behind the actual bandage site. And there are what are called occlusive bandages or occlusive dressings in there, which is basically just a little sheet of really thin plastic type material, and you can use that as a impromptu chest seal, or any kind of gaping chest wound or sucking chest wound where somebody would have a gunshot wound to their chest and puncture their lung. As they attempt to breathe, they're going to be sucking air in and out of their chest cavity through that bullet hole. So you're going to want to close that up. You can use the occlusive dressing that is in here to do that with the occlusive dressing and duct tape. As you can see here, I have a little roll of duct tape that's lashed onto this keeper with some paracord, and you can basically just slap down the occlusive over a gunshot wound or sucking chest wound. And the main thing to remember is you do not want to tape all four sides of it off. You're going to only, make sure you get it nice and flat and tight to the chest, and only tape off 3 sides of the occlusive or the halo chest seal or whatever kind of seal you might be using. That way it's going to allow that excess air to escape the chest. And when they go to breathe, the occlusive wound or the occlusive dressing or the chest seal is going to suck to their chest and prevent any excess air from going into the chest cavity. And then when they exhale, it's going to allow the extra pressure to escape. So that's pretty much it. Also, these do have wound packing gauze inside that little sleeve behind the actual dressing that I mentioned also. So basically what you're getting here, this is why I really like these, you're getting an Israeli-style compression bandage, 2 occlusive dressings that can be used as a chest seal, and wound packing gauze all in one package. You can open this up and just use it as is immediately and just use it as a straight compression bandage, or you can open this up, reach into that little sleeve behind the actual bandage and pull out 2 occlusive dressings or the wound packing gauze that's stored in there also, and use those for all different things. So yeah, that's my quick little overview of the basics of what the basics are as far as having a trauma kit or a blowout kit to take with you to the range or any other type of situation where you think you might need a trauma kit or a blowout kit. If you have any questions, don't hesitate to ask in the comments, and thanks for watching.